Hello, everyone, and welcome to 2 Minute Emergency. I am your host, Dr. Leslie, board certified emergency physician, best-selling author, international speaker, and professional photographer. And I am here today to talk to you about a topic that is relatively unknown to too many people, unfortunately. And what is the topic today? It is prostate cancer. This week is Prostate Cancer Awareness Day. So let me start by saying I am talking specifically to the men out there. Women do not have a prostate, therefore not an issue that we have. But prostate cancer is widespread throughout the world, more so in the United States. And in 2021 so far, there have been over 248,000 cases of prostate cancer. Now, you may have heard of it before, and people wonder, well, okay, what is prostate cancer? So the prostate is a gland found in men, and that's where a lot of semen is produced. And what happens is there's an overproliferation, or too many cells grow. These cancerous cells grow. They make the prostate enlarged, and they cause some signs and symptoms. So some of those signs and symptoms that people may find is difficulty with urination, either getting a stream started or ending a stream, or kind of starting and stopping. Some men have issues where they have to urinate sitting down. They can no longer stand up to urinate. One of the things that many people know, because sometimes they think, oh, well, that's just having to do with my age and nothing more. So definitely not the case. One of the other things that can happen is you may see blood in either your semen or in your urine. Now, infection can cause this as well, but if you see these problems, you need to think about prostate cancer. Who's at risk for prostate cancer? Of course, all men, but specifically men who have a history or family history of prostate cancer. So this includes especially your father, or if you have a sibling that has prostate cancer, it increases your risk significantly. Now, the communities that are disproportionately affected are the African American communities. And that they actually account for, I believe it is 65% of prostate cancer deaths. Now, how does this happen? Well, think about it as so many men in the US have prostate cancer, live, die, no idea that they even have prostate cancer. And it's reported that about 80% of men over the age of 80 have some degree of prostate cancer. Now, that does not mean that it's going to affect their life in any way. But what happens when you do have prostate cancer is it easily moves to the adjacent organs as well as bones. So some of the signs you may see is, in addition to what I already mentioned, you may have low back pain. And starts around the hip area. It can be the anterior thighs as well as the low back. Now, when it becomes an emergency is when the cancer, the tumor, actually causes compression of the spinal cord. So that's after it's moved from the prostate gland to the adjacent spine, and that's the most common place for it to metastasize, and a decrease in the spine structure or an increase in tumor size pushes on the spinal cord. Now, when that happens, there are different symptoms. So you may have a weakness or a numbness in your legs, difficulty with walking or even standing, difficulty obviously with urination as well. And that numbness and pain can even go into the groin. If that happens, that is an emergency. It's not, oh, I'll make an appointment with my doctor. No, that means go directly to the emergency department. Because once that tumor causes pressure on your spine, that is something that needs to be taken care of immediately, because it can be irreversible if not treated. Okay, so that's the biggest take-home message, irreversible. So as I said before, as far as people being diagnosed, so 1 in 9 men are diagnosed with prostate cancer. And 1 in 39 of those diagnosed die from the disease. Now, that sounds like a lot, but in actuality, given the number of men who have prostate cancer, the survival rates, 5-year survival rates, are very high. Now, the survival rates depend on how advanced the disease is when it's detected, and of course, other health factors. So obviously, if you've got major other medical problems, that's going to weigh in. But the 5-year survival to anyone who has localized cancer or even just regional is nearly 100%. But once it's spread, it goes all the way down to 30% at 5 years. When you put all the numbers together, because so few people still die of prostate cancer, they live with it, but die of it, it actually ends up being a 98% survival at 5 years. I hope those numbers made sense for you. That's about where it stands. Now, as I said before, more common in the African American community, 60% more, okay? So they're also more likely to have advanced disease when it is detected. This is the importance of screening tests. So any man age 50 should start having prostate screening exams. This is regardless of whether you have a family history or not. And I know from the emergency medicine perspective, men are very hesitant to have a prostate exam. It is not a big deal. Just saying, it's very quick, very simple. All right? It's worth it to save your life. Now, if you have a family history, as I said, father, or even more so, a brother who has had prostate cancer, your screening needs to start at age 40. No questions about it. Age 40. This is something that can save your life, a simple screening exam. And no, we can't just check by doing a urine exam. It's not going to work that way. You need to have the physical exam done. So other things that are risk factors. No one knows exactly, aside from heredity, what the risk factors are for prostate cancer. However, there are things that are found to be contributory. So one is a fatty diet. So we're talking about a lot of your meats, your dairy products, and a diet just high in fat, saturated fat, fried food, fast food, all those things that too many people enjoy. They're related to prostate cancer. With that, generally, is decreased fruits and vegetables. So cut back on the fats. Eat more fruits and vegetables. It could make a huge difference. And there are a lot of other things that have been used that are natural to help treat or slow down the progression of prostate cancer. I personally am not an expert in that field, and therefore I would refer you to your physician to find out more about those areas. All right. Another thing is, I don't know if you're familiar with the Brachy gene, BRCA1 and 2, and we typically think about those being associated with breast cancer, but they're also associated with prostate cancer. So if that runs in the women that live in your family, you might want to be checked even if you're a man, because it's that same gene. Just something to keep in mind. That's basically what I have for you today. As I said, this is Prostate Cancer Awareness Week. And also want to make sure that if you have any of the symptoms that I mentioned, so that's difficulty urinating, that's pain in your lower back, that's unexplained, that's difficulty with ejaculation, that's blood in your semen, that's leaking when you cough or sneeze, that's painful urination. All of those things need medical evaluation. So if you're having any of those, guys, go get checked out. All right, I hope you found that helpful. Once again, I am Dr. Leslie, board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these 2-minute emergencies to help keep you healthy, safe, and out of the emergency department. Until next time, take care and stay safe.